And we're live.
All right, so we're back, health and welfare again on January 31st, and we're continuing to go through bills that have been briefly presented this morning. So we'll go back. What are we on now? S1?
S1.
Okay.
Somebody mentioned Senator Lucy. 1 year, the first day, we went through S1 to S85, 87. Every one of them was Senator Lucy's.
Well, the longer you're around, the more ideas you get. Okay.
All right. So again, Jennifer Carvey from the Office of Legislative Counsel. This is S1. This is an act relating to providing Medicaid equivalent coverage to all Vermonters. This would add a new subchapter in 13 VSA Chapter 18, which is the chapter where the 48 Unified Universal Healthcare System and the exchange statutes currently are subchapters 1 and 2. This would add a new subchapter 3 on Medicaid equivalent coverage. And it starts out with Section 1851 that directs the Agency of Human Services to provide hospital, medical, dental, and prescription drug coverage equivalent to covered in the Vermont Medicaid state plan to all Vermont residents, regardless of their household income, as follows. And it does kind of age cohorts over time. So to individuals up to 26 years of age for coverage beginning in 2029, to individuals who are, as it says, not less than 55 years of age and not more than the age of eligibility for federal Medicare, the federal Medicare program, which currently is, you become eligible at 65. So 55 to 64 for coverage beginning in 2030. To individuals who are between 45 and 54 for coverage beginning in 2031. To individuals who are 35 to 44 years of age for coverage beginning in 2032. And to individuals who are between 26 and 34 for coverage beginning in 2033, at which time all Vermont residents would be eligible for coverage. Then it requires by September 1st of this year in Section 2 that the Secretary of Human Services request approval from CMS, Centers for Medicare and Medicaid Services, to amend Vermont's Global Commitment to Health Section 1115 demonstration waiver demonstration to make all Vermont residents eligible for hospital, medical, dental, and prescription drug coverage equivalent to the coverage in Vermont, the Vermont Medicaid state plan, regardless of income, as set forth in Section 1. And if CMS does not approve our request, Vermont's request for federal financial participation in providing that coverage, then the coverage would be funded with state-only dollars. Section 3 gets some information about what that would look like. So Section 3 directs the Agency of Human Services in consultation with the Green Mountain Care Board and the Department of Financial Regulation to first estimate the costs of providing that coverage, including the amount of state funds that would be required to support the program through full implementation in 2020 and 2033, both with and without federal Medicaid dollars. So cost estimates, both with and without federal financial participation. Second, estimate the potential cost offsets in the healthcare system and elsewhere in the economy as a result of all Vermont residents having access to Medicaid equivalent coverage. And third, develop and propose a detailed implementation plan for providing that coverage, beginning with individuals up to age 26 in 2029 and continuing through full implementation in 2033. And that report would be due by January 15th of 2026 to various committees, including this committee and finance. Section 4 directs the Department of Taxes by January 15th of the following year, 2027, in consultation with the Agency of Human Services to provide this committee and other committees, including finance, with options for structuring a payroll tax to generate the revenue necessary to support the state portion of the expansion, both with and without federal Medicaid dollars, based on the Agency of Human Services cost estimates and any subsequent fiscal analysis. And it would have the department's report, this is the Department of Taxes, set forth at least 3 payroll tax options and include the department's recommendation for which option is the most administratively feasible for employers, employees, and the state. Effective dates, section 1, providing that Medicaid equivalent coverage for all Vermont residents beginning with up to age 26 would take effect on January 1st, 2029. The remaining sections take effect on passage.
Well, this looks like the work that we did with Dr. Shao, spending a lot of money for the report on payroll tax options, and he came back in with a report that even the governor or the governor who could support the program.
Pushing. I mean,
It was devastating for, in particular politically for him, but the report indicated the huge amount of money that needs to be raised for the state to do this independent of the federal government.
And there was another study done back in the 90s. And the number came in and the Speaker of the House pulled the bill and wouldn't let it go to the floor because
Single payer for the single state of Vermont is a difficult place to be. Unfortunately, it's just very costly in a state that doesn't have the resources to do it.
look at Canada.
I know.
50%
Well,
income tax.
I mean, the idea is so compelling.
It is,
Yeah,
but the numbers are so
the
big.
numbers are dissuading. Go ahead.
Have we ever,
Go ahead.
no. Vermont, we're just too small. They're too old, too expensive. But I wonder if we could do it as a New England coalition.
Tried to do that with renewable energy and greenhouse gas reduction goals and
But this might
gasoline
work
costs.
better.
Huh?
I mean, maybe even New Hampshire can talk to us.
Well, that's a different look, but
Yeah.
it's something that I think we've talked about before. I know.
Sure we have.
I've talked about it. We've all talked about how could we get a coalition together to build a program that is cost effective and would work with a number of states.
Boston in this mix.
Yeah. Senator Gulick gets chomping.
Chomping it, I have
Go
a
ahead.
lot of caffeine and I'm not done yet, so. I appreciate the look back and putting this into a historical context. I think that's valid. At the same time, I know that we are not in the same, we're not in the same place that we were in years ago in terms of like the strength and viability and economic stability of our healthcare system. So I think maybe it deserves a look in the current environment that we're in, which is really precarious, as we all know. I think it's in, looking back isn't necessarily completely, I don't want to say relevant, but it's not accurate at this point.
So what we will do is what I'm going to ask of us is to be patient with this one, simply because it is a significant amount of work and it will require some resources to do all the analysis here. That look back is still relevant. It will cost money and who can do it? Joint fiscal right now.
No, they couldn't.
This is not there.
They could contract out.
And
for
Diva
it, but-
can't do it. They can, so we can talk about that and how it might happen. And then we'll be looking at, as I've said before, we'll be looking at a bill that we can produce in here that might begin to attenuate the real emergency that we have, then also look within a shorter frame. But so I agree. This is, I think Senator Cummings and I are agreeing that there's something that would be very wonderful about having this single payer program. And the question is, can we afford to look at it now? And can we afford it overall? But
We updated the PICUS education report.
right.
Maybe we could find out what it would cost to have
the shower
the
report.
shower report updated to today's numbers. Because he designed the Taiwan system.
Yeah. So would you want to talk with Nolan, or joint fiscal about, thinking about that as an option here? And we will, and I'm gonna say that I think the bill is huge. So it's
Yeah,
not,
you went through the worst of the wars in here.
We-
This committee, I don't think went home before midnight
no,
for 6 months.
it was not.
It was a lot of work that went into it.
So I'll let you.
Robin, I think, had a cot here.
Oh, Robin had a cot. We all had cots. Okay,
48 was one of mine.
it was
One
one
of
of
my
yours.
bills.
Did you have a cot in here too? No, you had a cot.
Late night.
No, it was. It was,
Okay.
yeah, Robin was the drafter and you were the nut.
No,
No,
I was the
you were
draft.
the
No, Jen was the
Yeah,
draft.
she was the,
She went to
was
the
the
executive
governor.
branch. Yep.
that's right, she was
She was the
governor's
head.
health chair.
She was the
That's
director of healthcare reform in the governor's office.
That's right.
Yeah,
Yeah.
okay, you're leaving. You're
Oh.
coming back.
So some of us do have scars from these
I'll be right
former battles.
It's good.
You brought most of them up this morning.
I wanted to have a conversation with you all. It's really more procedural, but then I wanted Senator Gulick to hear it because it's pertinent to her interest. So what we'll do is just take a 5-minute offline. We don't need